Get a single girl you want, send in the dog phone. I got a dog phone. Make me sing to these bitch. Hey, see JoJo. Everything. Yo,
Oh
yo,
yeah,
yo.
yeah. New intro today. New intro
Yeah.
today.
That's that new future?
Yeah, the new future. High tech.
Okay, okay.
All right, let me slow this down a little bit as people come through. I'm bopping to it nowadays, man.
I gotta download it, man. I gotta download it.
I hear you. Hold on, let me write this down.
What's going on, folks?
What's up, people?
All right, man. You wanna get started?
Let's do it, bro.
What's going on, everybody? I hope you guys are in good spirits, safe and healthy right now. Today is Thursday, May 21st. My name is Gavin Webb from STOOP55. I'm joined here and welcoming back my broski, Dr. Denrick Cooper.
What's up, man? It's been a while. Glad to be back after a brief hiatus.
Yeah, man. Working hard. He is the Director of International Emergency Care at a hospital in New Orleans currently. Again, Dr. Cooper will be answering your questions. He will be giving you the latest on the public health crisis and speaking with our special guest today, systems engineer Christopher Warner, who works in healthcare data and system workflows. Today's topic for our discussion is contact tracing and healthcare data systems. But before we get started, I just wanted to thank everybody who donated to our From the Front Lines PPE campaign. We really appreciate it. We really appreciate it. We were able to double our goal of $1,000 and raise $2,000. Yes, $2,000.
Clap that up. Clap that up, please. Clap that up.
For the production of N95 masks. So we really appreciate that. We really appreciate everybody who donated. Thank you, thank you, thank you. Last weekend, I had the pleasure of going to Brooklyn Hospital and giving the mask to Dr. Lola, one of the emergency medicine attendings at the hospital. Thank you, Dr. Lola, and thank you everybody at Brooklyn Hospital, the nurses, the doctors, the medical staff, the hospital staff. We appreciate your service, and we hope these N95 masks help you as you work and continue to save lives out there on the front line.
Of course, of course.
So, yeah, man, to kick off today's discussion, I sort of wanted to create a little bit of context around contact tracing and healthcare systems and data analysis a little bit. For people who don't know what contact tracing is, I'm going to just put out the definition according to WebMD. It is the process of identifying people who may have come in contact with an infected person and subsequent collection of further information about these contacts. And Dr. Cooper, feel free to jump in if there's any correction that you need to make. WebMD, you know, they're good, but I'd rather hear from you.
Yeah, man. I mean, first, let me reiterate the thank you to everybody.
Yeah.
We hit our goal. We raised $2,000 and brought that money to get N95s to Brooklyn hospital workers. So we really can't thank you enough for all the support. Even if you didn't give it to us in monetary funds, you gave it to us being there for us spiritually, mentally, physically as we did it. And we really do support them and support everyone else that has helped us through the journey, all right? To kind of get back on exactly what you were saying, Gab, yeah, I mean, that's pretty much the point blank definition, but there's a lot of things that go into contact tracing, right?
Sure.
And just to give a brief history from the medical standpoint, or even more the public health standpoint, this is how we really try to get rid of and control diseases that are not very prevalent, meaning that they're not very common, because it's a bit difficult to do it manually. So what goes into it? We've been doing this for years. We actually do this with tuberculosis. We do this with measles. They did this during the Ebola crisis as well. Mainly, if you have enough of the resources, especially human resources, people are found to have an infection. They usually end up going to the hospital or some sort of medical provider. And from there, you know their identity. You can sit down, talk to them, even if it means bringing the healthcare to them, talk to them in their household. And then from there, you get a little bit of a history. All right, where have you been? Who have you come across? How many people live in your household? Really getting down the number of A, how many people you've been in contact with, and B, once you connect with those people, how many people really have symptoms? because it really helps the public healthcare system on multiple levels, right? One being that you can characterize a disease, right? Once you interview more people with it, you can get to some of the nitty gritty on what's behind the disease. How long does it last for? What kind of symptoms are you having? How prevalent is it in the community? So it really helps with disease characteristics. But as I said, there's a lot that goes into it besides just tracking someone down.
Mm-hmm.
You have to be able to speak with them, right? You have to be culturally competent to reach them where they are, right? Because there's sometimes some stigma associated with having a disease. So you're not necessarily going to talk to everybody about it and then have being released potentially to your neighbors or anyone else that's around you. Even though the case is not trying to release that information widely, you're trying to maintain privacy, it's still something that has to be considered. So that in a nutshell is a bit of what contact tracing is. It's a continuous cycle of getting people who are infected and getting in contact with those people who have been put in contact with them. Sorry, that was a bit backwards. And then trying to find out, if you can, trying to put a hold on that disease by isolating and quarantining the people that have been exposed.
Okay, okay. And I know there's a lot of different methods of contact tracing that people are talking about, whether it be mobile, digital contact tracing, or actual people picking up the phone and talking to those that are infected. But like before we get into the different methods of contact tracing, you know, on the show, we talked about, you know, the history of the marginalization of minorities within the healthcare system. We talked about the importance of testing in the Black community. We talked about determinants that cause, you know, the Black community to be more vulnerable to healthcare issues like the coronavirus. What are the preliminary measures that need to be taken in order for our community, the Black community, to benefit from any type of contact tracing?
So, I'm trying to put the topic on here. So, the biggest thing people really or can benefit from in the Black community is that they have to be open to testing, right? And testing has to be widely available first, which in a lot of areas it's not. So people have to be open to testing and being in a community where testing is enough that everyone can get tested, right? Especially in an area that's prevalent like in NYC. So in the Black community, they have to be open to it, have resources to get it done, and then have the ability to quarantine and isolate in their own communities, in their own houses, while still relaying information outside to the public healthcare sector.
Okay. I would love to hear more about how Chris feels on this subject, and I would love to hear more about how you guys sort of dissect this. So I'm going to go ahead and sign off.
I hear you, brother.
Welcome back, bro. Welcome back.
Thank you.
All right.
All right, my brother. So we'll get on my good friend of mine, family friend, Chris Warner. Sir, you want to hop on here? We have a long history, and I think it'll be a great addition to what's going on. Can give us a little bit more history and understanding what contact tracing is. Let me just set up him as you come in. You want to send that Ask Chris. There we go. All right. I want to welcome everybody to Christopher Warner as he pops up.
Huh.
How you doing, brother?
I'm sideways. Sorry about that.
There you go.
All right. You got me?
We had you for a second. Now, there we go. We going a little back. There we go. What's up with you, man? How you doing?
I'm good, man. How are you? It's good
to see you.
I'm doing well. Hanging in there as best as I can, you know. We're what, 5 months into this pandemic at this point, and I hope everybody else is hanging in there as well. I know it's difficult. It's not easy. So Yeah, I'm doing as best as I can.
I'm hearing you. Welcome to the show. Welcome to the
Thank you.
Stoop.
Avid fan, big time fan of the show. Thanks for having me. I'm happy to be here.
Appreciate it. Appreciate it. Just a little bit of background. My relationship with Chris. So Chris is the elder brother of a good friend of mine, Stephen Warner, in the background, who does a lot of production for STOOP55. It actually started to happen from your crib. So when I say this is really homegrown, it truly is. Now,
Truly.
Chris, you mind letting the people know who you are, what you do, just a little bit of a
Right.
background so we can hop up for our conversation.
Right. So I have a degree in computer science. Essentially, what I do now is work for a life sciences company who manages clinical trials for big pharmaceutical companies. Um, and my day to day, at least for the most part, is dealing with our infrastructure and our systems over there. But I do have hands into some of the data outside of the company that I work at. So essentially, what I do is just make sure that we can reason from our data and come up with hopefully answers to some of the questions that plague us. That's my day to day.
Cool, cool, very cool. And what, when you say data, what specifically, what kinds of things are you looking into? What's important? What kind of decisions get made from the data that you cultivate?
Right. So there's many different forms of data. We're talking about data as it relates primarily to life sciences. So specifically, quote unquote, big data, looking at populations, different populations, and how they react to certain drugs. We're looking at small groups of the larger population and trying to understand how, not just how drugs affect them, but how they go about getting access to healthcare, getting access to the drugs. Some of them have problems getting access to healthcare in general, and then further, some of them don't know drugs exist or clinical trials exist. So there's a whole bunch of different data, different problems, different issues, specifically involving the Black community, but also the people or person of color community as well. So there's just a lot of different things that we don't know. You know, people have this idea of healthcare, that healthcare is like, you know, you have your doctor and your doctor knows everything. And we have specific doctors who know about specific diseases and they know everything. And I mean, I'm sure you can attest that it's really not like that. It's more along the lines of everybody's trying to figure it out as they go along and share information and come up with reasonable hypothesis. Maybe every now and then we get a clear answer as to what's actually happening, but for the most part, it's just asking the right questions or trying to ask the right questions based on the data that we have.
I hear you. So, how has your day-to-day changed from the coronavirus, right? Everyone's kind of at home working. You were talking about using data. Has it changed for you at all in terms of your day-to-day, or have provided any limitations, or does it provide more work?
Yeah, so I think day to day it's been at least at the life sciences company I work or I would spend most of my time, day to day has kind of slowed down in regards to some of my responsibilities. But outside that, in regards to data, the data that's coming in is coming from all over the place, right? Um, Unfortunately, we don't have, as a country, specific guidelines and protocols for collecting data as it relates to pandemics. We had somebody, um, a smart person who was in office who set up and I'm sure you know what I'm talking about. He set up an office to deal with this specific issue. And, you know, like Forrest Gump said, stupid is as stupid does. our current administration disassembled that whole office. And quite frankly, even with it in place, there's a lot of different pieces to this puzzle, right? It's not just about having an office in place, but it's also about, you know, the hyper-local healthcare system, the life science industry, the data industry, privacy. There's a lot of different pieces to this puzzle that we haven't even scratched the surface on. We're not even looking at right now, to be quite frank. And there's just a lot of work to do. There's a lot of work to do.
You just unloaded a lot of stuff there that we could jump into, my brother. A lot of stuff's in there, I'm not gonna lie. So how about we just updating everybody? We're talking about contact tracing with a health data manager here, an expert in terms of what that means for us as the lay people. So just in general, for contact tracing, get everybody on the same page, for the pandemic to get controlled, and what they're doing in a lot of countries, is that they're trying to find people who were infected, who they've come in contact with. So normally, manually, what you can do now, this is without technology, which we're going to talk about right now, is that people can go from household to household and try to get in contact with those contacts, right? Those people who are affected, who are exposed. If you get in touch with that as a cycle, you can track down people that need to be isolated, quarantined, and ultimately, if you can, treat them for other diseases like, as I said, tuberculosis. They did that for Ebola. They actually do this for HIV as well. And a subset of contact tracing we actually do for sexually transmitted diseases. So in the emergency room, say if somebody is newly diagnosed with HIV or may have gonorrhea or chlamydia, we'll ask them, hey, can you contact your partners? And for other reasons, for something like tuberculosis, we call the health department, and they get in contact with those people. So we talked about it doing it manually, but now we're in 2020, right? So what does that look like right now from what you've seen so far, Chris?
Right. So, I mean, I can talk to a couple of programs specifically, but before I talk about that, I want to talk a little bit about the fact that having technology or technology that will help us, it's just a tool, right? So I don't want anything that I say to be taken as we have this tool, we employ this tool, it works. It's a part of a larger system. But to that point, you know, I will talk about Apple and Google's program that they're coming out with now to provide contact tracing through an application using Bluetooth, which uses radio waves, right? So you don't have to necessarily go knock on somebody's door or get, 6 feet away from them. You can be a couple of feet, 10, 15, 20 feet, in some cases more than that, 30, 40 feet, and be able to do contact tracing in a crowdsourced manner, right? So that means you have your phone on you, it has Bluetooth enabled, Bluetooth 5.0, Bluetooth 4.0, those different protocols. But so long as you have Bluetooth, you'll be able to send information to somebody who's going to take that information and reason with it. So at the end of the day, the idea of saying, cool, I'm going to go around with a clipboard, a piece of paper, a pen, knock on this person's door, say, listen, do you have symptoms? Have you shown symptoms within the last 14 days? If you haven't shown symptoms, fine. Did you get in contact with this person or try to do that? The effort required is low, and we're able to get data in that regard more quickly. However, there are other pieces to this, right? So especially in our communities, it's important to understand that to do tracing properly, right? It's a piece of a puzzle, right? We need testing, right? Like my mom. You know what my mom says: don't put the cart before the horse. Basically, we need to have a cohesive system in place, especially for our communities, that comprises testing. Local hospitals. We've had a bunch of hospitals close in Brooklyn, specifically. Hospitals in Park Slope, hospitals in Bed-Stuy. We have Interfaith that's underwater with patients right now. So basically, we have to have a full system in place to be able to use the technology that is available to us well, because otherwise, you know, we're not doing anything. We're wasting a lot of time.
Cool. So it seems like there are other external things that need to be in place too before we do that. But say so what I'm seeing a lot of in other countries, they're doing it. Like we're seeing South Korea, Singapore. Can you tell me what their models are and how they are able to do it?
Right. So basically, the social dynamic is much different, right? So in Singapore or South Korea, the people cooperate. They cooperate with their local government, their local officials. They have quote unquote these leaders, these squads who are able to go out and say, "Cool, you had a symptoms, or what was one symptom? Let's look at where you were, who you interacted with, what restaurant, what bar, gym, the different places you went, and talk to some of the people that you might have come in contact with." For the most part, all that stuff is shut down, so people aren't going there. So when you have that social dynamic where people are willing to cooperate, it helps. In the U.S., we have the complete opposite, right? We see people protesting, not wanting to cooperate, not wanting to wear masks. Asian culture, mask is just part of everyday life. You see people walking around with masks out of courtesy for the people around them, to make sure that whatever they have, whatever cold, flu, whatever's going on, they go ahead and don't pass it on. So, and those different, across the globe, people are handling it differently, specifically in Asia, but in Asia, they already have that social dynamic, and the processes and the systems in place that make it much easier for them to quarantine and make sure that the virus doesn't spread. Taking temperature, the whole 9 yards. So we have literally none of that in place here in the U.S.
So I guess what I get concerned about from an individual's point, right, is say we're cool with contact tracing. Everyone's concerned about, all right, I don't want the government knowing my information and my moves, right? Will we have to sacrifice some sort of privacy in order for this to happen? What are the privacy issues you see coming across this?
Oh man, Kamathi, Dr. Cooper. That's a question. All right, so that's a can of worms, right? So that's a tough question. That's going to take a week to answer, but I'll try.
Hit us.
Basically, here in the U.S., we don't really have a national privacy law. In Europe, you have what is known as the General Protection Data Regulation, Privacy Data Regulation, GPDR, law that went into effect. I believe it was 2 years ago or something like that. That takes people's privacy completely seriously, right? Even then, though, there's ways that data could possibly get out, but at least it's a start, right, on their end. Here in the U.S., we have nothing. We have private corporations who say they're going to do the best to take care of your private data. We've seen the numerous breaches that have occurred, billions of dollars lost. It's become a bit of a, I mean, just caught with your pants down on a consistent basis here in the U.S. And until we get larger privacy laws, it's tough for me to say your information is going to be 100% secure, even if Google or Apple or whatever company tells you that they're going to make sure that your contact tracing information is anonymized and encrypted. The likelihood is that at some point in the chain, whether it's through a third-party contractor or some other company, it's unlikely to be secure all the way through that pipeline. So I don't want our community specifically to be scared of using contact tracing apps. It's a tool. It's a piece of the puzzle that is definitely going to help, especially in our communities that are closer and tight-knit and being affected tremendously by this process. But it's something that you should do with an eye towards making sure that you're not putting anything in there that doesn't need to be in there. So, you know, if you like to eat ice cream on Sundays, and it asks you for that information, it doesn't seem necessary as part of this COVID bit. I would go ahead and leave that out. So we don't know what type of ice cream you like.
So from I guess the tech side, the companies, you know, where they're always looking for a buck in terms of American capitalism.
Mm-hmm.
Do Google and Apple and these tech creators have some sort of incentive to create this app so they can get more information on the population in general?
Yeah, so
I don't know, for advertising, or everyone's always
yeah,
talking about Facebook getting into my computer and knowing what I'm doing. I mean, people get scared, right?
yeah,
You're looking
yeah,
through your Facebook or Instagram, all of a sudden you see
no.
something that you were just talking about on there. Is that something that's relatable?
So that's a good question. I wish I had some reps from Apple and Google. I can get some people here for this show, so I'll take that as a to-do. But what I will say is that they are putting together, from what I know from the employees and actually some directors over at Apple and Google, I know right now, is that essentially they're putting together programs. There have been issues where data hasn't been as secure as it needs to be. But I don't want to badmouth any of these people before they get a chance to speak on it themselves.
Yeah.
So I'll pass that information on to Stephen, and maybe we can get we'll see if we can get some of those people here on the show, because I think that would be cool for them to explain.
But we'll leave that for them. We'll put them on the stoop another time.
Yeah, put them on the spot.
Now, you talked about the Black community specifically, right? We're very much affected by this pandemic. In terms of contact tracing, are there vulnerable populations for contact tracing? Like, would the Black community be one? And if so, what could they do about it? Is it something they have to think about?
Right. So yes, and quite frankly, this is another huge problem. You guys had Farah. She's running for New York State Assembly on the show a couple weeks ago. Shouts to Farah. I think it's important. Yes, I think it's important that we have people like her and her team advocating for us, specifically at that level. But I also think that when we start talking about how our communities are affected, we have to look at the whole social dynamic. Where are more African Americans going to be working, right? So we look at the service industry, we look at our garbage men, we look at our restaurant workers, we look at where we live, right? So when we start talking about contact tracing, we still have isolated sort of communal residents in Brooklyn or New York in general, right? We have Asian communities, we have African American communities, we have Jewish communities, and we need to go ahead and figure out how to deal with this problem in a way that allows us to still respect those communities. And in some cases, we take a look at the Jewish community, their religious practices. We look at the Asian community. We look see how tight knit their families are and how they commune, how they communally live. And then we look at our own community, and we can see that the infection rates are, like I was having a conversation with my sister, a couple of days ago. The infection rates are 1,600% in comparison to other communities around us, right? And in that specific case, we're looking at a Black community on both sides, and in the center, we're looking at a white community who has 12 infections. And it goes to show you the stark differences based on the data. We have a problem. How do we solve that problem? It's going to take people, Dr. Cooper, us looking left and right at each other and trying to figure out how we go about making sure that not only are we represented and advocated for, but we're also making sure that we take care of each other on a day-to-day basis.
True, very true. We have to hold ourselves accountable to lift each other up. I think that's very well, and as you push, you have to pull at the same time. Shout out to Neff, thank you for that. Either way, for our next time, I've heard people talk about centralized and decentralized applications for this. What exactly does that mean?
Right, so earlier we talked about the Bluetooth, being able to essentially have your phone in your pocket, just walk around and provide the information that is required for people to make reasoning, right? Our local officials, our doctors, our emergency care workers make decisions about, where, in this case, COVID is going, and how best we can solve those problems and issues. Unfortunately, this whole idea of decentralized versus centralized, it rings a little bit hollow, right? So we have decentralized ways of collecting data, but the data eventually goes back to central sources, right? So it gets bubbled all the way up to, let's say, the CDC, NIH, those sort of organizations, so that then they can go ahead and make some determinations about how the infection rate is proceeding or declining or whatever. And then this is based on geography and location and all those sorts of facets, and correlations are made and et cetera. But at the end of the day, the whole process is something that should be centralized when we're talking about infectious diseases. And it's hard for me to see the data. It's hard for somebody like me to see the data and rationalize it as, a county thing, right? Or a specific region. COVID does not care about your region. The only thing it cares about is replicating itself. It's a virus, and if you're human, that's all it needs. So we're all humans, and we all live on this planet. So we have to be working with organizations like the WHO, which, again, stupid is as stupid does, threaten them. But we should be working with organizations like that to make sure that we're coming up with systems, protocols. We're working with governments, and we need to be working with governments because they have the supply chains necessary to make sure that we get what we need, and then we can bubble that down into our communities. But right now, what we have is the complete opposite. We have states fighting against states. We have a complete lack of testing. It's a bit of a mess, but it's something that hopefully smart people wake up, and we can work through this when we look left, look right, promote and get people like Farah, I'm going to shout her out again, into New York State Assembly, that sort of thing. We're going to need to actually put some elbow grease into making sure that we do the work necessary. So, yeah.
So a lot of large theme of what you're saying. Just to remind everyone, we're here talking about contact tracing with health data expert Christopher Warner. You touched on it a little bit. How does leadership really affect how these health systems, more so the data in and of itself, is mined and distributed all throughout the states and then ultimately used? I think you've definitely been talking about it in piecemeal, but I want to hear everyone here all together,
Right. So, data is king, right? Having data allows us to reason, allows us to make decisions. And the lack of that puts us in a situation where we can't make those decisions. Our leaders can't make those decisions because they're not informed. Even in cases where we do have data, it's being cherry picked, right? It's being cherry picked from one community. It's being cherry picked from this. It's not coming in a whole sort of kit and caboodle, right? It's not a full package. And what we need is for our federal government to enact some guidelines, but also to provide a data format or structure so that we can then proceed to have hospitals, clinics, all these sort of different levels of healthcare providing information into one format, so that then we can really go ahead and perform science, right? We can then give our leaders, say, listen, the data is here, right?
Mm-hmm.
We have African Americans being affected, 3, 4, 5 times more than other communities. What are we going to do about that specifically here? We have the Jewish community who still wants to practice their religious practices. We have to figure out a way to allow them to do that if we can, okay, and come up with systems and methods to make sure that we're respecting their community. We have the Asian. We have all these different communities. We have all of these different things going on. We need to have a singular sort of format and protocol in regards to making sure that we deal with a lot of these problems of healthcare, these pandemics, these viruses, these plagues, these things that are going to continually happen and happen more as the population of the earth increases, right? We're surging up. We're going to see much more viruses, much more pandemics occur. Vaccines take forever to create. It's not going to be 6 months. You're talking about a vaccine taking at earliest 2 to 3 years before we get vaccines. So it's a larger problem, but we need to be promoting leaders who actively want to rise to the occasion and take on the challenge and work together. We have to stop working against each other. We have to stop seeing this as a competition. This is not, the US against Russia or, Africa against Europe. When it comes to diseases and infectious diseases that are highly transmissible, the disease does not care. If you want to fight against each other, it'll help you to pile bodies up, essentially. So I don't know what we're going to have to do a couple weeks from now, a couple months from now, years from now. I do know it involves having people who want to rise to the occasion and accept the challenge, and have those people working together. The sooner we get those people who take this seriously and who want to help solve some of these issues, put some of the pieces to the puzzle together, the sooner we're going to start to see healthcare just in general change across the board, globally.
So with that said, I do want to hear your vision of what the future holds, right? First, a perfect future where we have enough testing and we can actually use, and we have the appropriate resources to use the data to actually perform contact tracing. What will that look like? And then also, how will that change health data in the future? Does that make sense? Yeah, like, what do you think is going to happen over the next, like, what if not year, 5 years, or
right. So
I keep saying that this is the new norm. So what is the new norm from your side?
So perfect world, federal government steps in, says, listen, we're going to deal with COVID-19 first. Here's a protocol. Here are the guidelines. Here's the contact tracing app we provide, because we have much more data at our disposal than you do. And here are the supply chains that we're going to use. We're going to enact, manufacturing across not just the military, but also require private organizations who have the capability to provide masks, to provide those masks to the standard, whether that be N95 or some other standard we come up with. And we start working on getting data from communities at the zip code level, and providing that to a larger organization who can then drill down and make sure that, okay, cool, this area has a higher infection rate. Let's go ahead and make sure they have the resources that they need. Let's look at their local hospital. Let's look at the structure around there. And, perfect world, we get rid of COVID, short order. We're looking at maybe a year or two, and everybody cooperates. Perfect world. Longer term perfect world, 5-7 years out, we have a better program set up at the federal level to make sure that disparate communities or communities that have been affected the most to pandemics have all of those pieces in place, as well as working with the WHO and other governments across the globe to make sure that we have a bigger, larger, more refined protocol in place as it relates to highly transmissible infectious diseases, and making sure that we're refining that program continually, looking at each other's healthcare systems, and taking that data and then really drilling down and making sure that we look at different populations and providing care for those populations, providing custom drugs, if you will, for those populations, and making sure that we continue to iterate and do proper science going forward. So in a perfect world, that's ideal. That's my ideal. We can reach that, I think, in 5 to 7 years. This is not something that we can't do, right? We've as a country, we've gone to the moon. We're still eating off of those innovations that we came up with in the 60s and 70s. So it's possible for us to say, let's get serious about this. Let's make sure that we take this to the next level. And I know there's a fear in regards to the industry. I know there's a fear in regards to, doctors and scientists thinking they're going to be paid less, when in fact, once you have all of the pieces that you need, it's big business at that point, right? Being able to provide custom drugs, being able to provide vaccines, being able to come up with healthcare plans that work for this population and this population and that population. It's all part of making sure that we're healthy, but it's also it's big business, and we can do much more of that and much more business, good business, and healthy business for all of us, if we take these appropriate steps. But right now, there's a lot of from what I'm aware, from the papers I've read, the data I see, scientists I talk to, doctors I talk to. We're all just trying to do different things with a slight different, twist to it, fighting against each other, trying to get the same resources. It's just we're spending a lot of time and effort just wasting time.
So I want to get into some of the questions people are asking. Please ask questions while we have him here. Use this knowledge. So someone asked before, a little bit separate where we're going about iPhones, that the iPhone recently sent out an update. And it says that that COVID-related data infrastructure is being added. Should people add this on their phones? Is there any concern? I know you say you want to leave it to the Apple people, but we got to pick your brain while you're here.
So I know, what I will say is that privacy is a huge thing, right? Apple, believe it or not, Apple has become a big healthcare company. People don't realize how much healthcare data Apple already has. Your iPhone, even down to your AirPods, when you have your AirPods while you're running, they're collecting all this information, your sleep data, when you have your phone on, all this information is already being collected, quite frankly. Now I know for sure they do take measures to make sure that that data is anonymized and encrypted. However, without good data protection laws here in our country, it's tough to, I don't want to give everybody the green light and say, oh, your data is going to be secure, there's no problem with Apple. What would Apple do? Apple's got no problem, especially, since I know recently they've been in the news because there was a high-level Apple employee who quit because of some of the Siri stuff that was going on. But
you're not comforting me now, man.
I know.
Comforting me.
What I will say is that, like I said again, there's a lot of the information that you want to give to make sure that you're healthy and you're safe and your family's healthy and your family's safe. It should be okay to give that information. I wouldn't, like I said, I wouldn't give anything beyond the very basics at this point without proper data regulation and laws and privacy laws in this country. Anybody could eventually get that data, and I would rather them have data that says, you know, I'm a black male, I'm 40 years old, and you know, that's pretty much it. I'm 150 pounds. I'm not lying about that. A
Well,
little,
everybody knows now,
but
all across the internet. So
right. So we basically right now the way it is, you could go online and look up any information you want on anybody and essentially get a lot of information that is in public databases. So I can find out where you live, probably, you know, your brothers, your sisters, your wife, if you have one, if you've ever been in jail, that sort of thing. I can pull all that up just with public stuff, and that doesn't go into, you know, nefarious actors or state actors who will then begin to drill down into that. So I tell everybody all the time, put the most basic stuff in, use different passwords everywhere. Um, Again, don't put the fact that you like chocolate chip ice cream and then be the only one in your block who likes chocolate chip ice cream. It makes it very easy to figure out who likes the chocolate chip ice cream. So, yeah.
So with that said, with contact tracing, I get concerned. I guess from the physician side, I always get concerned because once you are labeled with something, there's a stigma, right? And not to say that everyone will know it's you, but just like you said, hey, you're the only one to share it, and you're the only one you're blocked. Maybe people will be able to put two and two together, right? So is there any concern, I have my own concern, is there any concern that this information will be used against people to kind of as stigmatize them, or companies or jobs can use it to say, you know what, you have it, you shouldn't be coming to work. Kind of like in the same way HIV was used in the early 80s before we had a cure for it.
Yep.
So it's definitely something I get concerned about with myself and my patients.
Right.
Have you thought about that, or what are your thoughts on that?
Yeah, I'm a big proponent on making sure I encrypt everything. To that point, it remains to be seen, right? There is a possibility that this information could be used against you because we don't have any regulation at all. Somebody could pull up information on you that says, you know, you were arrested or you have this sort of disease or had this sort of disease and wants to discriminate against you. And there's really no way you would know. So it's one of these things where it's really, it pays to pare down as much information that you put out. It's all based on making sure that you put the least amount of information that you can and get the biggest bang from that information. But yeah, it's really the wild wild west out here at this point. So it's a valid concern. I think there's a lot of people right now. I know a couple of different young women who should also be on this show, MIT data scientists and some others who are actively talking about this continually. It goes beyond just somebody using it against you, but it goes back to artificial intelligence bias. There's a whole host of different ways that this information could come back to essentially cause you issues or have people discriminate against you. And, you know, as African Americans, we already know that's a thing. And again, this is why we need to shout outs to Farah again. We need to go ahead and be promoting people who are actively aware of these issues and concerns, especially as they relate to the Black community, who understand. Again, read the book Medical Apartheid by Harriet Washington. It's one of the most insightful books in regards to dealing with these issues and how they've been going on for the last, 500-600 years. So it's important to just have that knowledge, know what you plan to share, be very methodical about how you deal with your data, and make sure that, you're constantly making sure you don't put out more information than is required. Somebody asks you again, like I keep going back to this example, but it's a perfect example. If somebody asks you, you know, what type of ice cream you like, and you're talking about healthcare, and ice cream has absolutely nothing to do with it, don't provide them that information. And then also just be very, very vocal. Ask questions. Do I need to provide that information? If I don't need to provide it, then I'm not going to provide it. Right.
I hear you. Thank you. And once again, reminding everybody, we're here with Christopher Warner, data information, health data expert, sorry. And he's here with us talking about contact tracing, right? This is one of the ways we can fight against COVID-19 spread by finding everyone that has been in contact with those that have had it, right? So we can appropriately quarantine and isolate them. Now, I really want everybody to keep on asking questions, right? Before we actually run out of time, we don't have too much longer. But I do want to get to a little of your questions that people said before. We were just talking about all the things, and really you made me feel uneasy about how much access people can have to my information, right? So how do we build trust in those communities that are most vulnerable to this kind of technology? What do we actually say to them? What would you say to the people that are on here?
Right. So to everybody watching, hi, I see Matthew's mom there. What I would say is that just remember we don't have those privacy laws in place, right? We don't have data regulation in place as a national program. There've been guidelines, but nobody needs to follow guidelines, right? There's no real teeth to guidelines at the end of the day. So one, I would say, like I just said, be careful about what specifically you share. In regards to trust in our communities, this is a bigger problem. We look at diversity in clinical trials and the data around there. We look at diversity in general and some of the issues there. I would say that it's important, again, to make sure that we are looking for people who are going to represent us soup to nuts. A lot of this goes back to policy and having proper policy, and a lot of it goes back to looking left and right, making sure that I can look to you, Dr. Cooper, and ask a question in regards to making sure that my data is going to be safe, and you giving me an answer and saying, listen, I can't necessarily promise, and being honest. I think that goes a long way in our community, being honest about what you can and can't do and what you want to happen, and then making sure that we go ahead and hold people to task. And that goes back to policy and making sure that we have people in place who are willing to advocate and fight for policy that is going to protect us, rather than, you know, leave us out in the wind, which is where we are right now. And our communities are being devastated by this pandemic. So we need to go ahead and make sure, if people always say vote, I'm not talking about vote on the national level. I'm talking about in your community. And sometimes the person who has to lead has to be you. So sometimes you can't look left and right. Sometimes you have to just go ahead and put on your boots and be the person willing to take that next step and say, listen, I want to make sure that our data is safe in our community. I want to make sure that we have the resources that we need in our community. I need to go ahead and make sure that at the end of the day, my mom, my sister, my brother, my family, my aunt, my cousin, my next door neighbor is also taken care of. What specifically do we have to do and organize house by house, block by block, if required, zip code by zip code, and making sure that we get the answers required to protect not only of ourselves, but hold people to task and hold people accountable. So shout out to Farah again. I hope she sees this.
Are you working for her? What's up?
I'm not working for her.
Nah, you good.
I'm not working for her yet, but the way things are going, I want to see her win.
There's nothing wrong with being inspired, you know.
Yeah.
I think that's pretty cool on her part. It says a lot to the message she's really sending out. So thank you so much. Chris, is there any last words you want to part us with? That was a great ending, but I do want to know any other last words you want us to part with?
Yeah, I hope everybody stays safe. If you follow the media, I recommend that you don't. Go ahead and make sure that you take your safety, your health seriously, because it's all you have. Health is wealth. You know, and we'll get through this. I would rather you guys be alive and at home than to be at a job that you don't like and or that's going to put you at risk for a couple of bucks. So if you need a place to stay, call me. We only got a couple people on this call. I have enough space. So don't go out there. Stay safe. Be healthy.
Thank you so much, Chris, for coming to the Stoop. We appreciate all your information. It was extremely helpful for the community that we serve in here. And we'll see you next time around.
Okay. Thank you, guys. I appreciate it. Thanks for having me.
Take care, brother.
Later.
All right, people, as we finish up another great episode talking about contact tracing, we thank Chris again for coming on to the Stoop. There's a lot of information to be aware of how contact tracing is affected by our leadership and a lot of external factors. Really, the fact that we have to get testing on point. We have to hold our leaders accountable. We have to hold each other accountable to get some of these things into place for it to actually work. It may be working in other countries, but the current model and really how Americans are responding to it, it probably won't work here. So keep that all in mind as you download that next app and as you talk that trash near your phone about your friend, because they may know. No, all seriously, first to finish up, I want to say thank you again to everybody who helped out, raise funds. We raised over $2,000, got it to Brooklyn Hospital, so we're extremely thankful and really elated that we were able to do this, right? Secondarily, we're going to start on the Stoop IG. We want to start posting people who are living and thriving during Corona. It's really changing the new norms for everyone, right? So please send us your pictures of you thriving during Corona, living throughout this, right? Everyone's on quarantine. So to see what everyone else is experiencing will really be dope. And we really want to highlight that people are actually continuing to live and persevere despite it, right? So see everyone later. And once again, even though we are apart, we'll get much further together. Stay safe, stay healthy, and stay aware. Good night.